right. Okay. Good afternoon, everyone. Welcome to the GTA Real Estate Industry Association's response webinar. My name is Michael Brooks. I'm the CEO of RealPAC, a national real estate trade association for commercial real estate, as are my colleagues, and I'm very happy to welcome everybody this afternoon. I hope everybody is safe and well. This is a special joint webinar of leading Toronto area real estate organizations, RealPAC, BOMA Toronto, Coronet, NAIOP, Toronto Commercial Real Estate Women, also known as Toronto CREW, and ULI Toronto. And as a group, these organizations are already working jointly to advance diversity and inclusion to our industry. So we know each other, we work well together, and we represent amongst ourselves every corner of the industry. I should give a special shout out to Richard Joy of the ULI Toronto, who actually started this initiative amongst ourselves. His first email goes back to March 25th. We're probably at home for a couple of weeks by then. And this is about linkages. This is about linking the real estate community with the needs of the healthcare sector, social service agencies, and the long-term care community. Matching the what do you need with the what have we got or can access. And all of us as associations are proud to help. And this isn't just personal protective equipment, but it also includes stuff relating to real estate. Do we need to lend space for such needs as logistics, or expanded shelter, or testing facilities, or parking and accommodation for frontline healthcare workers? So we're pleased to focus our collective resources towards this industry response against this global COVID-19 pandemic. So today's webinar is designed to draw focus to an industry call to action that we launched 2 weeks ago with the release of a joint survey of our members that is being facilitated by the Canadian Urban Institute, who we thank for their support and broader leadership across the country. In this survey, we compiled a list of resources that we identified as being needed by those who are on the front lines of the COVID-19 battle, namely the hospital sector, City of Toronto, United Way of Greater Toronto. And we will circulate the survey to you all in case you missed it, possibly adding additional resource asks that are identified during this webinar. A few housekeeping items. The webinar is being recorded and will be made available through the websites of the organizing groups. We encourage questions and are asking our audience to send them via the Q&A function button or the chat box at the bottom. We will do our best to answer as many as possible, and we'll endeavor to follow up if you identify yourself clearly. And if you're going to tweet about this, the Twitter hashtag is hashtag COVID-19 response TO. We're joined today by senior representatives of two of these leads, Deputy Mayor Anna Baileo and United Way of Greater Toronto President and CEO Daniele Zanotti. We're also joined by several industry leaders who we wanted to spotlight for the work that they are doing to contribute. So, without further ado, and because we have a tight schedule, I'll simply turn the virtual podium over to City of Toronto Deputy Mayor Anna Baileo, and who will give us a quick 5-minute overview of the needs of the city-led effort in this week 8 of the pandemic response effort. And then I will ask Daniele to follow immediately after. So with that, I'll introduce it over to you, Councillor Baileo.
Thank you, Michael, and thanks for everyone that has joined us today for everything that you've already done. Thanks to all the organizations that came together to host the webinar and to continue this call to action. We are living unprecedented times around the world and as individuals, and that calls for unprecedented actions. I think that our governments have come together in unprecedented collaboration efforts. And in the City of Toronto, we very often say that the goal is to save lives and to save livelihoods. And we're getting more and more into the stage where we're looking forward to the reopening, the slowly reopening, but with many issues still to address as we do that. And that's where we're focusing on the livelihoods. We've had an unprecedented collaboration between nonprofit sector, and I'm sure Daniele will speak about that a little bit, but also we've seen an incredible amount of solidarity in the city from all sectors, and the real estate sector has been involved in many of the actions that we've been taking. We've had unprecedented needs in terms of PPEs, in terms of food. But today I want to focus a little bit on the requests that we put forward on your survey, which has a lot to do with the housing needs. I think many of you have seen some great results of some of the partnerships that we've been able to create with the industry. Just this weekend in the media, there was the result of 2 buildings that we've worked with a developer to do a lease. 50 of those units have been furnished as well by one of your members as well, with donations, with furniture that people are able to keep as well. And this is a real need for rental units, for long-term leases, for hotel rooms. The city continues to be looking for opportunities to partner with the industry and to look into these opportunities to ensure that not only we protect people now, but we're also looking for some long-lasting results in the area of housing. You probably heard as well about our modular housing project that we're launching, and these 2 projects, the first 110 units, will be on city land. But if people also have land that could be available for that, we're very much interested in having those conversations. So not only land, rental units, lease units, and buildings that people might now think that they could probably partner with us, with the city. We will be putting out another call for our Open Door program, and we're hoping to see that to see many of these projects that are probably looking and reviewing their performance as they're coming along to maybe go through that process and create more affordable housing as we see the need increasing, not decreasing in the city. And as we see our goal to save lives and livelihoods as a big part of that, to be involving your industry and creating the affordable housing and supportive housing that we need in the city of Toronto. So I'm looking forward to answering your questions and to express once again my huge gratitude for all you've been doing, for your cooperation, your participation, your donations, and encourage you to continue to do that, because when we say that we're all in this together, we really need to be all in this together. And the only way that we are is recognizing that people are living through the pandemic in very different ways, and that we all have a role to play. And if we can have, if we have the means to donate, if we have something that could probably help some of our neighbors, some of our fellow citizens, I think this is the time to put it forward and to come together as a city to make sure that we get through this all together.
Thank you, Anna, and thank you, Michael, for amazing Italian pronunciation of my name. Thank you all for being part of this and inviting United Way to be part of it. As you might know, United Way has been at the center of local community impact in the Greater Toronto Area since the 1950s. The fastest, most effective, efficient, accountable way to get dollars to our most vulnerable. And we do that at United Way Greater Toronto through a network of over 270 agencies sprawled in neighborhoods in Toronto, Peel, and York region. In communities across Canada, United Way is the largest investor in social services next to government. In COVID GTA, we are continuing to occupy that central space between government, corporations, donors, and the community. Most specifically, we've partnered with the City of Toronto formally as the direct link between their emergency response team and the community. We've done the same in the region of Peel and York. What that means in Toronto is that we are co-chairing with the city 9 place-based tables where community agencies meet daily, talk about priorities, problems, issues, and how we can solve them together. And in Peel and York, that is taking the form of community tables focused on food, seniors, homelessness, and mental health. Every day, those pressures are emerging, and we've got real-time data that is coming in from United Way founded 211, and we've got qualitative data that is coming from our daily discussions with all of these agencies on the ground across the GTA. In the early days, you can imagine our agencies were focused primarily on getting their people and staff to work at home and provide home-based supports for our most vulnerable. Most recently, the key issues that are emerging from our community tables are not surprisingly food. It is the #1 issue that has come from 211 as well, with a quadrupling of calls. Mental health supports, whether that's around domestic violence or a precipitous decline in child abuse reporting cases, not surprisingly, given the fact that our key connectors to abuse are not working directly with kids. Income support and the need to get money to people. But more recently, what started to emerge is the need for PPEs. Anna has mentioned this, PPEs for the often invisible frontline staff, the homeless shelter worker, the senior worker or volunteer delivering Meals on Wheels. And so the importance of PPEs for this invisible group of frontline workers. Programming space with social distancing. The previous social service space that was open for our agencies is no longer sufficient, and they require bigger spaces so they can provide supports to the same amount of people with all of the proper social distancing protocols. And Anna has referenced, of course, housing space to continue to provide supports to our homeless. We've had great experience already of corporate partners who have stepped in. Denton's, for example, has provided PPEs for our frontline staff across Canada. And most recently, we've been in discussion with NTD Trucks, who has provided trucks and drivers so that a number of our agencies can be reaching out. Behind the scenes, United Way is continuing to do what we do best. So first of all, every month, United Way invests $6 million in this network of 270 agencies. And we continue to do that every month. And we've given them flexibility to use it where and how they need it. We've also rolled out in the last 3 weeks about $1 million in emergency funding. This is to over 120 projects across the city focused on seniors, food, mental health, and homelessness, the very priorities that I've talked to you about. And we continue to raise money for that. And then most recently, we've been partnering with the federal government on 2 streams of emergency response. The first is New Horizons funding for seniors. The GTA has about $820,000 to administer for emergency response. We've turned that proposal around, and we will see money flowing to frontline agencies in the next week or 2. And a recent federal announcement of $350 million to be divided amongst United Ways in Canada, foundations, Red Cross, and a number of other charities. We're awaiting for the details of that, and we'll allocate those dollars as quickly. As important as those emergency response dollars are, and they are, equally important is the long-term sustainable funding of many of our partners so that this social infrastructure is ready today and for many decades to come. And the type of supports that you've identified, space, PPEs, critical for us to make sure our frontline staff can continue to work at the right clip it's important we continue to have local solutions that are connected to the city and the regions so that we've got a system response rather than a series of disaggregated agency responses. Thanks for your time.
Daniela, thank you. Daniele, thank you very much for that. I like saying your name. Daniele Zanotti. It just rolls off the tongue so well. Yeah, thank you for that. Thank you for the great work that you do. Anna, thank you for the great work that you're doing for the City of Toronto. We're all in this together, and it's heartening to hear about the work that you're both doing. It's my pleasure to announce that we have, I believe, Andrew Bouzeri on the phone, who's the truly frontline Executive Director of Public Health at the University Health Network, who has called in on short notice. Andrew, are you on the line?
I am. Thank you.
Welcome, Andrew. Over to you for a few comments.
Well, thank you everyone for the invitation. We also have Rebecca Ripa, who's an Executive Vice President at the University Health Network with me as well. Just to really be brief, just really the, as a frontline doc in this, unprecedented challenge, I think as everyone has been feeling, and as the comments from the Deputy Mayor and Mr. Zanotti have made, that the truth around COVID-19 for us at the hospital level is that COVID-19 is not a great equalizer. It is actually a cruel disposer of long-standing income inequality and poverty, which we know to be a major determinant of health for us in the healthcare and hospital sector. In terms of the response, in terms of what we've been doing from our social medicine program, we've been very fortunate to have existing relationships and an MOU signed with the City of Toronto and United Way, where we were looking at the impacts around housing last year and looking at the terms of the interim and long-term solutions, knowing how inextricably linked housing is to health outcomes, both in COVID and through COVID. We've also been really fortunate to be asked to step up to work with our community partners, the City of Toronto, the Shelter Support System, and Toronto Public Health in setting up a isolation site for COVID positive patients who are experiencing homelessness and who would otherwise have nowhere to physically distance safely. We've been able to set that up in the last few weeks, again, to the merit of our partnerships in place, and are actively working on the second site to be up relatively soon, given, again, the further increase in testing and the challenges of COVID-19 in congregate settings. In terms of the needs, I think, again, I would reiterate the excellent comments from the Deputy Mayor and Daniele around the issues with respect to local solutions, the need for both interim housing pieces in terms of where the apartment building philanthropy was raised, but also looking at how we can help both with UHN with respect to interim to long-term solutions for housing, knowing the impacts on returning to hospital, but then also on things with respect to PPE, both at the isolation sites are in need, at the front line for health workers, and also for shelter staff and workers throughout the system, again, as mentioned by Daniele, around the invisibility, but really COVID-19 exposing just the courage that's there in the front line from all of our healthcare and allied health workers. So real needs on those fronts. Happy to stay around for questions if there's that directly from the healthcare piece. Rebecca, is there anything I don't know if she's on the line, but happy for Rebecca to weigh in as well on the personal protective equipment. But really a thank you for the invitation, a thank you for all of the partnerships in place, and hopeful that we can turn the corner soon.
Thanks, Andrew. It's Rebecca. Just to add, I think that it really as a system, it's highlighted for us the importance of having full supply and pandemic supply in place and good supply chains so that we're able to access them. I think what we have been effectively doing is linking ourselves up with different sectors, whether that be long-term care or whether that's been in community agency, and we've been, I think, working well in trying to make sure that people have what they need. And I think that that's going to be the challenge going forward. I know one of the thoughts going into this webinar was, what are some of the big needs? I would say that one of the biggest needs that seems to be in the community is the presence of disposable isolation gowns. And that's been one of the items that I think the hospitals have had readily in stock, and that's been one that we've been working with our partners to share in. And it seems to me that that's all of these items have been worldwide in terms of their shortage, and then relying again on agencies or organizations that have large purchasing power. So I would only add that I think that connectedness as a system is something that we've done during the pandemic, and I really hope it's something that we continue to do after the pandemic, because I think there are many advantages to the system to have that strength.
Terrific. Thanks very much, Rebecca, and thanks very much, Andrew. And you're certainly welcome to hang on the line. And once we get to the Q&A stage, maybe there'll be some questions sent your way. It's my pleasure now to turn it over to Constance Wrigley-Thomas, who's the Executive Director of the NAIOP Greater Toronto chapter, who will introduce some industry leaders on the real estate side for their points of view. Constance.
Great, thanks, Michael. And thank you, Deputy Mayor Bailau, Daniele Zanate, and Andrew Bazari, and also Rebecca Ripa. We appreciate your contributions, and you've certainly validated why we collectively and collaboratively as industry associations are pursuing this initiative. Our program will now pivot to some examples of companies that have taken early leadership in the aid of the city's COVID-19 relief and response effort. We have 3 such companies being represented on our panel today. So we have Anna Kennedy, Chief Operating Officer of Kingset Capital, Heather Gray-Wolf, Senior Vice President, Development and Stakeholder Relations of Capital Developments, and Matthew Suriano, Architect, Quadrangle. Our industry leaders will each speak for 5 minutes on their contributions to the effort, and then we will then turn the program over to questions and comments from all of our attendees, and a reminder that our audience can submit their questions via the chat box or the Q&A function button. So I'm now going to ask our first industry leader, Anna Kennedy, to speak, followed by Heather and then Matthew. And if you can also introduce yourselves to everyone. Anna?
Thank you, Constance. And hello, everyone. I'm Anna Kennedy, Chief Operating Officer at Kingset Capital. I'm honored today to have been asked to describe for you the Kingset Royal York Rest Safe program for frontline healthcare workers. On March 13th, Kingset made the decision to move to a work from home program following the recommendations of our governments in order to assist the community to keep the contagion from spreading, to flatten the curve, and to keep our staff and other stakeholders safe and well. We were so grateful that we had the capacity to continue to run our business while self-isolating to keep from getting infected and infecting others. However, there were so many who didn't have this luxury: the doctors, nurses, other technicians, selfless and courageous medical frontline workers in the COVID fight who chose to go to work every day. These are regular people who are often exhausted from extended shifts or concerned to go home for fear of compromising their families. So these were the heroes of the COVID battle who we thought were worthy of our support. Our CEO, John Love, and his wife, Nancy, supporters and donors of St. Mike's Hospital, together with John Barford, a Kingset board chair and also a supporter of St. Mike's, arranged a deal to offer the hospital up to 100 rooms per night at the Royal York Hotel for 6 weeks at a deeply discounted rate. The rooms would be offered to frontline workers free of charge, paid for 50% by the hospital foundation boards, and 50% would be funded by the Loves and the Barfords. Based on the positive reaction to this program, our CIO, Rob Coomer, who sits on the Sinai Foundation board, jumped on this opportunity to expand the program, organizing, offering, and donating the same program for an additional 100 rooms per night for 6 weeks to Sinai. Soon the program was extended for an even larger commitment of 300 rooms per night to UHN, to be supported by the remainder of the Kingset leadership team and several other stakeholders. Rooms at our Courtyard Marriott were also offered to the program for those workers who might find that a more convenient location to their hospital. In all, 500 rooms per night were made available to frontline workers from the end of March to mid-May. And since the usage has been lighter than expected, about 2,400 room nights in total, it is expected that the program will be extended. With this program, we offered some comfort and support to our frontline heroes, but we were also able to provide some employment by calling back some laid off workers of the hotel. And in closing, I would like to share some words from a grateful frontline worker who had just stayed at the Royal York in the Rest Safe program, who tweeted, "I feel humbled and almost embarrassed when people say that we do so much for frontlines, because I truly feel that everyone is really living a sacrifice right now for each other. I share the platitudes, the gratitudes, siren salutes, and pot-lit cheers with everyone. We're all in this together, united though isolated but not alone." So thanks very much, everyone, for the opportunity to talk to you about this Rest Safe program today. In closing, keep safe, everyone, and stay well. Thank you.
Thanks, Anna, and congratulations to yourself and to KingSett for such a great initiative. My name is Heather Gray-Wolf. I'm the Senior Vice President of Development with Capital Developments. And I'm so honored to be here today to speak to all of you in the industry about the great initiatives everyone is doing to do their part to help fight COVID-19. As my fellow panelists have so eloquently expressed, the COVID-19 pandemic is an extremely challenging time for us all, but especially for our vulnerable communities experiencing poverty, homelessness, and food insecurity. At Capital Developments, as city builders, as soon as the pandemic started to show its impact on the entire community and the city of Toronto, we put our minds to how can we step up and how can we help support vulnerable families and vulnerable children across the city of Toronto. As we're all aware, nonprofits and charities in this time across the city are being hit the hardest, just at the time when we need them the most. Developmental agencies like the Yonge Street Mission have had to pivot their operations to adhere to social distancing to ensure that there's no disruption in the services to the families who need them the most. They're facing unprecedented financial challenges. Food security is a major issue across the city, and the Yonge Street Mission is one of the largest food banks in the downtown east. They've seen an over 200% increase in demand. Many of the people who are first timers to the food bank because of job losses and economic instability. In the first few days of the pandemic, the Yonge Street Mission received almost 200 new clients. Under normal circumstances, they see 10 new clients per week. Due to the increased need, Yonge Street Mission is currently operating on a shortfall of $30,000 a week. They need $330,000 total to cover the next 11 weeks of operation. At Capital Developments, working with Yonge Street Mission, we've decided to launch the Yonge Street Mission Relay to fundraise and help them to meet their goal. This is a time when we can all make a real difference in our communities and support these critical agencies who need our help more than ever. We kick-started the Yonge Street Mission Relay last week with a $30,000 donation from Capital Developments to cover 1 week of operations during the pandemic to ensure that they can continue to provide food bank, meals, and mental health services that are so desperately needed right now. But we need help. We are challenging our city and our industry to help us meet the goal of $330,000 to cover the next 11 weeks of operation for the Yonge Street Mission. And we're so excited to say that in the first 48 hours of our appeal, the industry responded, stepping up to raise over 50% of our goal. Our real estate industry especially can step up and help support this massive need. So I'm looking to all of you in the audience to pass the baton to the industry to help generate food security in downtown Toronto for those who need it the most. I'm very proud to say that as soon as we reached out to a lot of our partners and friends like Woodbourne and Ellis Dawn, St. Thomas Developments, people stepped up very quickly to take on the challenge and reach out to those in their networks to continue the support for Yonge Street Mission. So we at Capital Developments are really proud to be part of this initiative. We're so proud to support the work, the very important work of the Yonge Street Mission. And we look to all of you to continue to support this mission, their initiative, and many other agencies that are working really hard to support healthcare workers and our vulnerable communities during these really challenging times. Thanks so much for the opportunity to speak to you all about this initiative today.
So thank you, Heather. Thank you, Anna. Hello, everybody, and thank you for having me today. As mentioned, my name is Matthew Ciano. I'm an architect at Quadrangle here in Toronto, and we've been part of a combined initiative to 3D print face shields for frontline workers. So I think, as most of us are aware, there was a shortage of personal protective equipment for frontline workers. It's definitely something we heard would be an issue earlier on at the start of the pandemic, and I would say almost immediately there were responses of how to sew your own face mask and create other personal protective items. But one of the big items which medical staff or frontline workers were saying they were needed, besides of course the N95 masks, were face shields. So Quadrangle as a studio heard this call, and we were looking for ways to help and produce face shields when we were contacted by Fritz Rovera, who along with industry partners Diamond Corp, Tricon Capital Group, and Center Corp Developments, were looking to collaborate with architecture firms that had digital fabrication tools to create from scratch the face shields. So Quadrangle automatically said yes, and together with architecture firms Turner Fleischer and IBI Group, have to date produced over 800 face shields for Michael Garron Hospital, North York General Hospital, as well as 2 long-term care homes in the city. So if we can go to the next slide. In terms of how this is getting done, Quadrangle and Turner Fleischer architects are using our 3D printers to print the frames, and IBI Group are laser cutting the face shields to complete the mask. The frames are made out of ABS 3D printed plastic, and the face shields are laser cut polycarbonate, which is actually the same material that medical goggles are made out of. The machines which we are using are ones that would typically in architecture studios be used to create physical models and help in the design process. So before we got started to mass produce the face shields, we did send several samples to hospitals to ensure they were of a quality which the hospital needed. And once we got a yes from the hospitals, this did kick us into gear to produce as many face shields as we can. As a group, we can produce about 250 face shields a week, and that's in a 5-day period, but we're often running the machines 7 days a week. In terms of logistics, this has all been done while we've all been socially isolated. So I know for us, it's been interesting because there's only one person in our office, which is our IT associate, Brian. He has never used a 3D printer before a few weeks ago, but through some video calls, we got him up to speed, and he's now not only ensuring we are all working from home remotely, but he's also running the machine 7 days a week and getting the face shield shipped to where they are needed. Next slide. A GoFundMe page has been set up for this initiative with a goal of fundraising $75,000. We have raised already 2/3 of that goal, which I think is absolutely fantastic. The donations are being solely dedicated to the manufacturing of face shields for hospitals in the Greater Toronto Area, as well as for long-term care homes. Any additional funds raised will be donated to hospitals and or organizations supporting individuals and families affected by COVID-19. Just to end off, I want to say thank you to all those who have already donated and to all the other team members who are part of this initiative. It's really great to see this industry step up when it's needed, and it makes me proud to be a part of it. So thank you.
Thank you, Matthew. My name is Richard Joy, Executive Director for ULI Toronto. This is now the time that we've dedicated to questions and answers from you, the attendees of our webinar. As you can see, there's only so far one question put in. We are asking if you type in a question that could be a comment. It could be an offer, perhaps to some of the asks that you've just heard, or it could be a matter of logistics to how you can be involved if you haven't understood that already, which is probably a few of you. We'll just take maybe run this for a little bit longer. We won't take up more time than is required, but we do have, of course, up until 1 o'clock if we get some more questions. The first question is pretty easy one in some ways. Is, can hotels fulfill the isolation/housing accommodation needs? Well, actually, maybe that's not such an easy question. And who to contact to offer this as a solution? I'm not sure. Maybe the first part of that question, I might turn to Anna just to. It sounds like you've had some experience, obviously, that hasn't fully subscribed all of the offer of that you've been able to put forward. Maybe do you want to maybe speak a little bit to that question if you want to round out what you've already offered us?
Sure.
Oh,
Sorry.
Yep, you're good.
Go ahead, Anna.
Oh, I'm sorry. I was thinking Anna Kennedy, but how about both of you speak to it? We're so blessed to have two Annas.
All right, I'll give you some thoughts on that. You know, we own 2 hotels, and because we are already connected to the hospitals through the foundation boards, we saw the opportunity to help out with frontline workers while utilizing the capacity of our hotels, and then, you know, helping the employees of the hotels as well. But I think that there are other people that may have, or other organizations that may have housing needs. It occurs to me that perhaps the universities may have need for additional housing because, you know, their residences have a large complement of doubled up rooms, which I'm sure that they're not going to want in September. So potentially they'll be looking for additional space as well. So if there's some capacity in hotels, maybe reaching out to the universities might be helpful. And there would be other organizations besides hospitals, I'm sure, that may be able to use hotel capacity as well, such as maybe even workers at seniors' homes and nursing homes. Over
Thank
to
you.
Anna.
Yeah, go ahead, Anna, Councillor Deputy Mayor.
Thank you. We too have been using hotels, especially with our homelessness population. And actually our isolation center is in one of those hotels, the work that Andrew talked about that we're doing with UHN. So it has been of great assistance. What we need now with those populations, what we're trying to look now is for the longer term solution, right? Because this one is not something that, you know, in 2 months, we don't want to send them back out to not having a home. So what we're trying to do is how do we do that transition? And that was some of the requests that I left in here as well, is not only for the immediate need, but if there's opportunities out there for the next 3, 6 months, a year that we should be talking about, we're very much open to having those conversations as well.
Great. Would either Daniele or Andrew want to add anything in terms of the accommodation piece from your perspectives?
To echo Deputy Mayor's comments, I think the city has been super innovative in accommodating a number of the homeless or those most vulnerable. If there's any opportunity to provide hotel space for frontline workers in some of our homeless drop-ins or seniors programs, that would be a wonderful opportunity as well to explore further with some of you.
Great, and I would only, you know, echo Mr. Zanotti and the Deputy Mayor's comments. I think that, you know, both on the interim solutions, that these are still challenges even in the hotel isolation sites of where Post-discharge from the site, there's the challenges, as others have raised, from food insecurity, income supports. We've tried to partner with West Neighborhood House around financial empowerment and coaching models for some of our patients at UHN, whether COVID positive or COVID negative. The economic burden is hitting everyone, and especially those who've already had sort of low income settings and having challenges with employment or on social assistance most severely. And then I think the other piece as well around, just again to support the Deputy Mayor's position on longer lasting solutions. There's been the commitment from UHN around land for the development in Parkdale for affordable and social housing, and are always actively looking for how we could support the supportive housing agenda as it relates to housing first with respect to health outcomes.
Thank you. And Michael Brooks, you made a point on the chat room. Maybe you could just speak to that as well.
Yeah, I was just thinking about other initiatives that we've heard about or seen from the real estate community, and everybody does this quietly. You have to ask them and kind of tell you what they're doing. But there's a number of other initiatives that I'm hearing about, and that some of those on the panel may comment on. But one was the hotel cleaning staff, who are underemployed, if not unemployed, given single-digit occupancy in most hotels, and making those staffs available for additional cleaning in healthcare facilities and seniors' homes. I've heard about that initiative, provided they have the proper PPE, which is very interesting. Second is providing parking for healthcare workers. So some of the real estate companies who have parking garages near healthcare facilities provide parking for free, so the healthcare workers can drive and not worry about who they might be potentially infecting taking public transit, for example, as an alternative. A third area that we've had some discussions around is some of this depends on the capacity of the hospitals and whether they need excess capacity, but the availability of tents for overflow facilities. Being outside today, it's not that warm a day, but some of these tents, they have air conditioning and they have heating, and having someone who has access to these large type of tents might also be something that would be welcomed by the healthcare community at some point.
Thank you. Okay, a couple more questions. Question from Emma West. The Deputy Mayor mentioned opportunities to explore housing options with the development community. Would these include temporary modular options similar to the projects that were announced last week? And if so, would they be looking for an expedited process for approval? Councillor Balau, I'm not sure if you're on mute.
Yes, I was on mute. So yes to expedited process for approval, and we are looking for opportunities to partner with others on these sites. We have approved 250. In our housing plan, we have 1,000, and we want to speed that up because we think this is the time that we need all those as soon as possible. So it was great to have the federal government coming to the table on these 250, and we hope to speed that conversation for the remaining of them. And it would be great if we could have these conversations with the sector as well.
Thank you. A question for Matthew, I think, from Maya Musala. Are the face shields reusable, and is there a target amount that is needed from this initiative? So I guess the question is, could it be, or should it be, ought it be expanded?
Yeah, so the frame of the face shield is definitely reusable. The clear covering does come off and can be replaced. To be honest, I'm not sure if they're being cleaned in the hospitals and long-term care homes to get used further. And then in terms of a target amount, we do have enough material to create 1,500 face shields. But I assume that if more is needed, we'll kind of extend that to create more.
Great, thank you. I think that, we have another question from Alexandra Hartford. Has a location been selected for the first modular housing project announced last week? Back to Councillor Belleau, Deputy Mayor Belleau.
We're just finishing the due diligence. Is 95% there. We should know about it in about a week or so. There's 2 sites already that are at that stage. And Richard, if I could, I just remember something, and I'm sure Daniela would be able to expand on this. One of the issues that we're starting to hear about is actually cooling spaces now for the summer. Because there's a significant amount of people that will not have air conditioning, and because of, for sure, the need still to have some social distancing, this is something that the nonprofit sector and the city will be looking for opportunities to create spaces where, you know, especially if we get those really warm days, that people are able to cool for a little bit. So that is another kind of space. As Danielle was asking for the space for the nonprofits, because they'll need to start having their functioning, and they need a little bit more space. So too, we need to create some spaces in the city for people to have the opportunity to cool off during the weeks and summer months that are coming ahead, especially if we have a very hot summer. So I'll leave that with people as well, if they have spaces that might be empty for the next few months, and that could facilitate some of those spaces. That would be important as well.
Great. And there's a comment from Jared Nomadic. Thank you all for the work you've been doing over the last few weeks. Building on the news last Thursday with implementing the Toronto Modular Housing Initiative, is there an opportunity to determine the success of this pilot project earlier on, prior to the fall delivery, and possibly add adjacent projects during the next few months? It's a question, sorry. This could be temporary or permanent housing projects. So I think, Deputy Mayor, that's back to you again.
So we are actually going to put out an RFQ for the next 140, even before we have occupancy on the first 110. So we are not waiting to finish the first 110. We will be obviously monitoring the success of all this, but the need is so great that we felt important to put the RFP out on the street as soon as possible. So in a few weeks, we're hoping to also have the RFP for the next 140.
Thank you. I think that takes us to the end of the questions that have come in. So we're on good time here. It's now my pleasure to turn the final part of the program to Susan Allen from BOMA Toronto to close us out. Susan, over to you.
Great. Thanks so much, Richard. It's been such an amazing discussion this afternoon. And on behalf of our organization, RealPAC, Cornet, NAOP, Toronto Crew, and ULI, I would like to thank all of you for joining us for our COVID-19 Real Estate Industry to Call Action webinar. And as Michael alluded to earlier, we are equally proud to be part of this collective. Also, a special thank you to our Deputy Mayor, Anna Belleau, and Daniela Zanotti, the President and CEO of the United Way of Greater Toronto. And another thank you to our industry leaders who have joined us: Anna Kennedy from King's Head Capital, Heather Gray-Wolf from Capital Developments, and Matthew Suriani from Quadrangle. Our deepest appreciation as well to Andrew Bazzari, the Executive Director of Health and Social Policy at UHN, and to Rebecca Repa for sharing your insights with us. And Andrew, on behalf of our entire industry, you and our colleagues have our deepest gratitude for all that you're doing to keep us safe and healthy. You know, this has been such an inspiring program, and our industry has once again come together in the spirit of collaboration and partnership. And there has never been a more profound time that we're truly all in this together. As we close out, I would like to remind you that we'll recirculate the survey, which we'll keep open until the end of the week for more submissions. And we'd love to hear of any of the transactions so we can update the site and keep it current as possible. Thank you so much again to all of our participants. Let's continue to connect, and please be safe, stay well out there, and have a wonderful afternoon. Thank you.